I call up Alison Scrase and her team from Bristol University, Southampton University. Floor is yours. What really matters in herd health advice? Now we're gonna hear it.
Hi, so I'm Alison Scrase. Recently became Alison Bard, so look for that name in future if you're interested in any of this research. I'm a PhD student based at the University of Bristol, and my research interest is really looking at communication and how that interacts with the uptake of advice, and I have a particular passion for farmer motivation and behaviour change. If I can work this. Oh, gone too far. So today I'm going to be talking to you about the advisory strategies that surround herd health advice and herd health planning. And I thought my data would be particularly interesting as this is such a critical component of modern dairy farming, but really that negative views on this process are quite common, and implementation of recommendations can be poor. And Dick Sibley said that, to integrate these plans into the farm agenda, what we really need is agreement and common purpose between vets and farmers and a level of engagement. And I'm hoping that my research can shed some light onto how we could achieve this in daily practice. So, how did I go about teasing apart this situation to bring you some ideas on what could improve herd health planning? Well, I took a very much a qualitative approach to my research and a methodology that was really set to investigate the advisory communication strategies on farm and how these relate to behaviour change in an in-depth way. And whilst we know that qualitative research can't be representative based on the sample sizes, what I really wanted was a very rigorous, in-depth and valid approach to understand the reality of advisory strategies in herd health for people working in this industry on a day-to-day basis. So I hope we can all take something meaningful from the results. I was initially primarily focusing on mastitis and lameness as this was the impetus behind my project. But because I used a very semi-structured approach to my interviews, what came out of them was actually this broad information on all of herd health, which is why I'm here talking to you today, because I'm hoping it can be of some use to you. And my qualitative research approach was to go out and interview vets and their respective farmers, and this was 24 in-depth interviews with 14 farmers and 10 vets of approximately 53 minutes each, and analyse this for core ideas that relate to the advisory process on farm, and perhaps how we can achieve better things in this herd health planning and advisory process. So when it comes to qualitative data, there is a lot of it. I ended up with over 200,000 words of data from transcribing these interviews, which is about a couple of novels, so you can appreciate that this takes a while to go through. So I started off looking at just a quarter of the data and manually coding it using a lot of post-its and paper and getting ideas and patterns that were coming out about things relating to advice and communication and behaviour change. I then moved on to moving this into a qualitative research package on a computer called NVivo 10, that allowed me to build a framework around these original ideas and patterns and condense the data into matrices, which was a very inductive process. So when I found things vets and farmers were saying that was of interest, I would create new codes and condense other people's ideas into the same areas to allow me to compare and contrast the things of interest that were coming up. And eventually, after this very long process, I ended up with a condensed data set that I was able to thematically analyse, which is really just a qualitative research approach, but again, identifying the patterns, connections, ideas, and ultimately themes or core ideas that come out of the data. And this is what I'm going to talk to you about today. So when it comes to the advice and communication strategies, there were 4 areas that seem really important, and these were change, communication, roles, and relationships. And this was anything to do with giving advice, receiving advice, seeking advice, and implementing change, and the positive and negative aspects of communication and the impacts and influences upon it. The veterinary role, other advisor roles, and the role of farmer groups and the other social groups they're a part of. And all the relationships that you can imagine on farm, with the vet, other advisors, colleagues, the family, and even the farmer's relationship with their cows and their herd. But today, because we only have a very short time period, I'm going to be talking to you about a core selection of these results, purely so we can get some depth and some ideas that might be relevant in terms of meeting this agreement and common purpose and what we can learn in a very short time frame. And so I'm going to talk a little bit about advice, giving advice, implementing change, the positive and negative views of communication, the veterinary role and the relationship between a farmer and a vet. So when it comes to communication on farm, the positives that were recorded, and these are really just a snapshot, the intuitive type of things that you might imagine, such as having a friendly attitude and being interested when giving advice, building partnership and using sensitivity and tact, and really using a lot of praise, honesty, and trying to cut out the jargon to stop disengagement. When it comes to the more negative side of things, arrogance is a big turn-off for farmers, as well as criticism and preaching and a lack of confidence in the advice that you're giving, as well as having a lack of these emotional qualities such as empathy and respect. And condescension was, again, a real turn-off that farmers and vets reported from using their understanding of the other side. But whilst I was interested in these nuts and bolts of communication, what they didn't really tell me is what shaped this, what shaped these communication patterns occurring, and why did they appear and influence giving advice. So the next kind of critical part of my research that came up that I wasn't so much expecting was the place of a vet-farmer relationship. And when you're looking at advice, this seemed to have a huge effect. So all of my vets and farmers to different degrees reported this as being an incredibly positive bond. They reported this unique working relationship. And this quote by one of the vets here, where he said, farmers trust you and they believe in you. And you're entrusted with something that is really quite sacred. And it's built upon this continuous interaction. So you're seeing farmers, sometimes week in, week out on fertility visits, and giving a perception of deep understanding of each other's priorities and motivations, because you're talking to each other all the time, and you almost have a friendship through this close bond. And this seemed to really interact with giving advice. So both parties, vets and farmers, reported that actually the advisory process and the strategies in herd health planning and in herd health advice were very much influenced by the relationship. And for example, this vet says, sometimes as a routine vet, you need not to be the person who tells them that they're bad at stuff. They might take offense and that would impact the relationship. So vets were very much aware of trying to protect this relationship and maybe compromising their advice in a way that meant they could stabilize this trust and this interaction. It also contributed to maybe a slightly informal style. So as many of you are aware, a lot of advice tends to happen in between cows on fertility. It's fitted around to build the needs of the farmer into the process. And this one said, you compromise on the communication method to achieve this. Additionally, both vets and farmers reported that this relationship meant that during the advisory process, they had a sense of a shared understanding, and it really underpinned it with this I guess, feeling of going towards a sense of group priorities. Now, what was really interesting is that I'd gone in looking at these nuts and bolts of communication, knowledge and advice, and what I come out with is that social perceptions and compassion and compromise and sensitivity and these social features are more important, and that farmers really felt understood by the vets, and that's what really underpinned these communication strategies. So why is there this issue in implementation of recommendations? Why are there negative views on this process? Well, I would say that it might be underpinned by this positive relationship, ironically. And as this farmer said here, a herd health plan is a chore that we have to do because we know what we're doing from week to week. And it's just that once a year we have to sit down and kind of make it official. So when you think that you understand each other's priorities and motivations, why do you need to have this structure? Why do you need to have this sit-down meeting when you know where you're going week on week and you have this incredibly personal bond? And this was really interesting for me. So what I thought is, what's the issue here? If everyone's on the same page and moving in a direction, maybe the herd health plan structure isn't the problem. But when you look at recent research, what we understand is that despite this intense relationship and this both perceiving that they have a shared identity and a set of priorities, that there is often a mismatch between vet and farmer perceptions on farm, and the farmer's perspective is often overlooked. And so what I would say is maybe it's because most of the conversations on farm, because they're underpinned by this relationship, as this vet kind of highlights, is that a lot of the conversations aren't about the cows, they're about the rugby or the family or a million other things that are interesting on the day. And sometimes evoking from the farmer what their priorities are and the motivations are gets lost. And maybe this is thwarting that kind of structured environment where we want to herd health plan, because the motivation to sit down and have these long discussions that are focused just on cattle health kind of gets lost in the normal everyday and the kind of relationships that are established on farm. So what I thought is, well, if this is truly the case, then what might make it visible or not if I look at the implementing change features in my interviews and try and understand if vets and farmers are saying the same priorities, and if they're saying the same priorities, maybe we're not having this issue of a mismatch between vets and farmers as reported in recent research. And what I found is that actually practical and attitudinal motivators and barriers to change were reported very similar between parties, but where vets failed to notice important factors that motivated farmers were these value-laden identities, such as pride, the quality of life that a farmer felt, a desire to achieve, and an intrinsic belief in their ability as a farmer. And when vets often said, as I've heard at this conference a few times, that often you know a farmer well enough to know if they're going to want to change, if they're motivated to change and what their priorities are, it's really interested that these really core intrinsic values are missed when vets talk about why farmers do the things they do. So I would ask you maybe to question this, I guess, traditional view of the vet role and the advice that we give, in that, often we think, well, either a farmer wants a reactive role, a proactive role, and because of this, the type of advisory strategy that we use can be quite resigned to that or quite facilitative if we think, oh, this guy's really proactive and we're going to do something great together. And I would say that perhaps it's more about integrating this with not just whether the farmer wants a proactive role or not, or a reactive role, but also whether a veterinarian thinks the farmer is motivated to change. Because I would question that maybe this quality here is what causes a more facilitative advisory strategy, or a less so, maybe a more resigned one. So you may end up going onto a farm where the farmer does just want a reactive role, but if you have a bit of belief in their motivation and your ability to engage them with the advice, you might be more facilitative than with a farmer that maybe does want something proactive, but you don't really believe that they can change. So my conclusion, and this might end up, I guess, with different approaches from the vet, such as I can motivate or push for best practice, which obviously has a positive effect for the farmer, or perhaps something less so, which might have a negative effect. So in conclusion, I guess I'd really like to just say and pose a question, is that whilst I understand that these social influences and communication in the role are really one feature of the complexity of herd health and all of the science that goes along behind it, how much of the herd health plan is about these practical health recommendations? And should we also be thinking about the communication styles that occur and where they come out of your role perception and the vet-farmer relationship that is incredibly positive but possibly shapes this occurrence? And finally, the expectations that we place on individuals about their capacity to change, which naturally change our behaviour. And maybe moving forward, the advice that you could take from this, although maybe I'm posing more questions than answers, is to challenge your perceptions of your clients. If you want to create agreement on common purpose and really engage farmers, think, do I know what this farmer wants? Ask the farmer for their input and their motivations and try and align these with the active herd health working plan. And maybe through this you can create a better sense of agreement and common purpose and move forward to more effective implementation of herd health plans and maybe engage farmers better in the structured processes that we're seeking to implement, as well as the daily interactions and advice on farm. And at the University of Bristol, we're developing a training package based on communication methodologies that we hope will fulfill this in the veterinary arena. So I'd just like to thank my supervisors at both Bristol and Southampton, Drs. Kristen Ryer, David Main, Becky Way, and Hasten MRO, and the BVA Animal Welfare Foundation, whose funding has brought me here, the cooperative group for helping me recruit, and obviously all the veterinarians and farmers without whom this would just not have been possible. Thanks very much. Any questions?
Thank you, Alison, Bart. I have to adapt. Questions? While someone is deciding, I got the feeling during your presentation that Bristol Vet School has not integrated a discipline like professional communication as imperative for all clinical sciences.
Oh, no, it's absolutely there, and the communication training is really strong. I think the issue is more, I guess, the culture that we see in any professional service, from vets to GPs to any arena where essentially everyone's paid to give advice, and that creates a certain kind of communication, which is often about telling someone what to do and how to do it, because that's the helping response. That's what we want to do to help farmers. But I think this is showing that maybe asking more questions and asking the farmer for their input and changing our mindset a little bit, to borrow a phrase from Theo Lam in the veterinary field, is what's maybe important for the next move forward.
Mostly because I know of a study in Western Europe about positive and negative perceptions of farmers about their vets in large animal practice. And number one complaint of farmers about the vets was they cannot listen. And I don't think that has changed a lot since that time. And I know that from other sociological studies that the effect of any advice depends for, say, 30% of its technical content and 70% of the proper execution of professional communication, perceptions, emotions, like you were saying, things like that, attitude, body language. And I'm still astonished to see that there are still many vet schools not paying attention at all to proper professional communication in small animals as well as in large animals. Are there questions in the meantime? Yes, please.
Did you find any difference between the attitude of younger and older farmers and veterinarians?
There was definitely quite a big variation in attitudes towards some things. I think because my sample size is quite small, I have to be quite careful in terms of saying that one demographic was different to another, because it's not meant to be representative. But I would say that, yes, this is more of a broad overview of like what I would call a core theme, but within that there was a lot of variation in terms of some herd managers on bigger farms might have slightly different views of giving advice with their vet to the smaller family farm. So absolutely there was big variation, but I wouldn't be really fair to point out the areas in which that occurred at this point. Thank you.
Okay, thanks again, Alison, for your speech.